things as the purpose of what we're going to deliver today. So, next slide, please. What is heart attack? Now, heart attack, like I used to say it in the Yoruba setting, that Olorun fi heart wa se olopa to ma mu wa. You see, when they said something attack, you have a dog that's around you every morning, play with you, you're happy to see you, you feed the dog, and he's happy to, play with you, jump at your back, and you're happy. And he came in one day, you same person, and the heart and the cat, the dog, start barking at you, want to actually attack you. Won't you be surprised that what could have gone wrong? What did I do to this dog? The dog I fed before I left the house, and I'm coming in, and the dog is now trying to attack me. What could I have done? That's exactly how it is. Because you will not understand what could have gone wrong between the time you wake up or you went to sleep and then heart attack will occur. You cannot understand it. You may not have any symptoms at all. That's what I'm trying to say. You may not have been able to pick that symptoms before the event is about to start. So, heart attack is about a clog of vessels. Our body has pipes, which we call arteries and veins, that moves around. That's what I tell people, that because that's the only way we can understand, because that's what we see regularly. So because if we don't see it regularly, you will not understand it. But for us that are into the field, we have seen it in dead body, we have seen it in live body, so we can understand what it means when we say pipe. So arteries and veins are things that carry blood around our body. Now, in our body, blood is supplied to reach everywhere through our heart. Where is our heart, please? Please, can you give the position of the heart? The heart is just on the left side of your chest, under the left breast. Okay, the head, the edge of the heart is just right away under the left breast. But at the location, we'll determine that from this bone, this one you call collarbone, the middle point of that collarbone, when we draw it down, it will pass through your nipple, and just down about 6 inches down the nipple, that's the head of the heart. Okay? That location, usually the location that the pain starts from, if only is going to start from there. You just feel under the breast a little sharp pain, and it stops. It tells you that, okay, look at this picture of the heart. So you see that it just converges. That location is where the whole thing starts. Because there's an artery that moves around, we call it coronary artery. That artery is the major artery that receives all the blood that comes from your body. It goes through that place to supply the heart itself. The heart itself gets blood before it supplies it to the whole body. So that coronary artery, sometimes something happened to it. The inside of the heart is damaged. Who could have gone there to damage it? Maybe blood pressure, maybe diet, maybe inactivity, maybe food or drinks, maybe smoking. Any factor could have been there. Maybe some other drugs that will have damaged that particular artery. So once that happens, or fat has laden that particular location, now that coronary artery begins to have problem of pumping blood through it easily. So as that is difficult to pass the blood through, the heart muscle is not receiving enough blood on its own. That's the heart that supplies the whole body the blood that the body needs. So once that heart itself is not receiving enough blood, the next thing that follows is what we call myocardial infarction. That means some areas of the heart begin to get dry. Infarction means cut off. So when the muscle is being cut off from blood flow, then the heart begins to ache. So that's the beginning of signs of heart attack. So once the coronary artery is blocked or flow is not adequate, the heart muscle is denied of blood flow. And when that happens, the next thing is pain. That's a sign that the owner of the body will experience. So that is a giveaway, the beginning of what is heart attack blockage. Then the condition leads to myocardial infarction. This can lead to complications or death if not taken care of immediately. Time is critical. Every minute matters for heart muscles to survive. So in case you are not aware, the heart muscle is called myocardium. And myocardium, as we call it, is a kind of a structure that depends solely on blood, because the body also provides blood to the body. The heart provides blood to the body. So the alarming increase among men is as this. The higher risk of heart attacks compared to women is more in men. Look at the graph. Look at the person there, show me the graph that's beside the place. So this shows that the increasing trend of heart attacks among young men is now noticed. Before now, what we more know is age of 60 and above. But now we're beginning to see 30s, 20, 30, even 20s. Yes. A young boy came to me 2 days ago. He's having kidney problem. He go for dialysis. He's just 38. And he said, doctor, I'm afraid. I said, what happened? He said, when I get to the center, I meet a lot of young boys and girls in their 20s. He's 38. He has gone over dialysis over 15 times, and already we're talking of that transplant now. So he said, what could have been responsible? I said, responsible. Most younger age now are now living a life of people at the age of 60, 65. Because you see a boy of 24 who already living like some of you here at the age of 60 in terms of what he has, what he's dealing with in life. So the question is that you are just 20 and you are chasing what a 60-year-old man have achieved. There's no way you will not come down with one disease or the other, because definitely either it will take away your sleep, or change your diet, or change your concentration of life, what you begin to think in your head, because you are dealing with too many things that's beyond your capacity. So that happens because the rate at which we are seeing it now, young ages are beginning to have hypertension. And then everybody's asking, hey, doctor, why are children having hypertension now? You see a child of less than 10 years having hypertension. I hope you're aware. You see somebody that's just the age of 15 that has stroke. And you'll be wondering that, she must have been 60, 70, not their age, other disease. Now younger people are having it. So that's the reason why everybody should be at alert. Early prevention and awareness can help us to reduce the rate of heart attacks. So, and this is what this church is doing today, giving us opportunity to know those signs. Causes of heart attack, like I mentioned, the common ones is smoke. And when I say smoke, some of us here don't smoke. In fact, all of us here, I can vouch that we don't smoke. But one way or the other, we still smoke. And our own smoking is worse than those that do the real smoking. We have what is called active smokers and passive smokers. Passive smokers are liable to die younger than even active smokers. This is the trend that the government should project out now that. And that's the reason why it was stopped that you don't smoke in the public. Because it was discovered that most people that were smoking were not actually coming down with disease. It is people around them that are falling full of disease. What's the reason? Anybody that smokes, with time, your lungs, your chest, get used to exhale. That means to remove it easily. But for those of us that don't smoke, our chest is not well trained. So anything that goes in, a lot of it stays there. That's the reason. So don't say, because my friend, I don't smoke, my friend smokes. You are worse than him. So, and anywhere they burn things regularly, you are around a place where there is tire burns, something burns that bring the smoke to you, to your room, to your house. Hey, beware, you are already dying small, faster than you can imagine. I lost a cousin recently, is an asthmatic patient. I passed my neighbor generator. The smoke was entering their sitting room, and the young man just from the sleep. And before Jack Robinson get to this hospital, he died. So the wife came back and said, generator, you look what coming. He said, how? Our generator is far away, but the exhaust is directed towards their room. But they are not aware that it was one that killed the young man. So you can be very careful about smoke. It's one of the things we're even telling. I had a meeting with Federal Safety recently, and I said, you guys want to stop somebody on driver's license and collect something. I said, you see cars are going with a lot of exhaust on the street, on the road. You'd never arrest those ones. They are the ones causing the more trouble for people living in Nigeria. Young ladies losing pregnancy is due to smoke that they also inhale. You inhale smoke, pregnancy is down, and then you keep having recurrent abortion or miscarriages, and you're wondering what is causing it. The smoke can lead to every other problem that cannot imagine. So the heart suffers a lot when smokes get into the system and is trapped in for too long. The lungs is above the heart. That is where the blood collects oxygen, take it back to the heart, and the heart pumps a oxygenated blood to the body. Unfortunately, when that kind of blood gets to the heart that has oxygen, the heart releases the oxygen and the blood and passes away and hold the smoke. I'm not sure you understand what I'm trying to say. Normally, the heart has 4 chambers, 4 rooms. The right atrium, the left atrium, the right ventricle, the left ventricle. 4 rooms. Every blood coming in the body enters the right atrium. When it enters, the right atrium passes to the left atrium, the left ventricle. The left ventricle passes to the lungs to collect oxygen and bring it to the left atrium. Left atrium passes to the left ventricle, and left ventricle passes around the whole body. So that's the journey of blood. That event that I've described with my mouth that's taking me that long is done in 1 second by the heart. So that's why your heart beats no less than 70 times in 1 minute. Can you imagine? So a heart that beats about 70 times in 1 minute, you know what it means? Such a process is too technical to stop at any point in time, or anything stop it or disturb its flow. Okay? So you realize that the event of heart function is so technical that heart become the organ for over 1,000 years on earth to determine whether somebody is alive or somebody is dead. Until recently, that medicine began to argue that it's not only heart that died before somebody is dead. We go back to medicine. The only organ that the day it started to be produced by God, that's the day it starts functioning, is only heart. Every other organ God created in our body, majority of them do not function at the time they are created until at another time. Some of them is even after we're born. These are our eyes. Do not see when we're there. It's only when you come to the house, you open your eyes. Our lungs, it was folded like a balloon. While you are there, it's not working. It's only when you come here that it blows up. The first cry, you can ask the matron. If the little baby did not cry, you see how the matron will slap the baby. Bah, bah. If that baby did not cry, the earlier he cried, the earlier the lungs will flow. If they didn't cry early, you see such children, they are never intelligent because oxygen flow to the brain will be delayed. So the earlier the child cries, hey, what you do? That means that the child is going to be a good, intelligent person. The capacity of your brain today is at the time when did you cry after you were born. So all of this are still functions of the heart. So the heart is so sensitive that it's like working from the day God starts to create it. And that is the 15th day to 21 day of pregnancy. Can you imagine? So once around that day, 14, 15 day, the cell that will form the heart starts. And at that moment, it starts working. Tim, 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 tim. The heart continues to form with it. On that small cell, tiny cell, start to form with it. By the time the pregnancy is like 18, 19, the heart is formed fully. And it's already functioning as at 14, 15 weeks. And it must continue functioning on that person is no more in existence before the person is dead. Someone can lose one eye and he'll still live another 100 years. You can lose one hand and live another 24 years. You can lose one leg and still live, but you cannot lose heart and live. It's not possible. So this tells us that you're talking of an organ that life actually depends on solely to become what human being is today. So when you look at that, so I've emphasized that, then alcohol, in case you're the type that takes, the doctor will tell you, red wine, they said it's good for health. I know you asked me as a question, but let me tell you it's not true. I quickly answer so that you don't ask for it when we're talking there. It's not true. So alcohol is destructive of even vessels. The pipe in your body will get, it's like putting like this microphone around a fire. What will happen to it? Oh, my carne now. So when you take alcohol, you actually roughen your vessels. They become stiffed. And when they are stiffed, then you have already prepared for hypertension. So alcohol intake has been a factor of this. So now, physical inactivity. Physical inactivity is a major problem to the rich ones. Now, or the ogas, you get to the office in the morning, you start on your seat by 8:30. You are there on that seat till 4 p.m. You call the secretary, they will bring the tea. You call the director, they will bring the file. It's not good, though. You are dying small. Get off your table, go and meet your secretary. Where is the file? It will help you. Let your secretary feel that, oh, director will soon be here. Oga will soon come here. You are not being lowered. You are helping yourself to move around. Then don't get to the house and cross your leg in the sitting room from 5 p.m. you came in. Madam will bring food to you on the table. The children will bring the paper to you on the table. Then you eat everything there from 5. You watch the TV till 7. Then you listen to the news by 9. Then it's 9:30. You want to go home. You want to go to bed and sleep. You have finished your life already. Between 5 to 9, you are sitting down on the same place It's not good for you. So inactivity has been one of the factors that also can promote a heart attack, or as the case may be. Like our father described, that he was sitting down, boiling water, and that period of sitting down, the event was already going on. You see, you get to hear a lot that the old man wake up to go and pee, and then he fell and collapsed. Is that not? During sleep, when every other organ is sleeping, for those that have hypertension is a prerequisite to heart attack, of course. The heart is still working above a resting level. I'm not sure you understand that statement. Every organ shuts down while you are lying down and when you are sleeping. But for those that have hypertension or have sleep problem, the heart continues working as if you are still on the road. So by the time you have slept about 3 to 4 hours, the heart is tired. Because the work is doing is too much. Over 24 hours, it does not rest. So by the time you wake up in the middle to go and pee, the heart cannot pump blood to the brain again. So you get up, blood supply to the brain is low. You just feel dizzy a little. Before you know what's happening, you fall. So a majority of people fall in the bathroom, either on their way to the bathroom or on their way back from the bathroom. And we get to see that more in the hospital. That developed toilet load with one shubu. And that's what we hear. So it tells you during sleep, a lot happens. And that's to tell you that even though sleep is a must to restore the body, but if someone has underlying problem or predisposing factors, then the sleep may not be good as a means of restoration, except you have done the right thing before you go to bed. So God help us. So high blood pressure and high cholesterol. Cholesterol is from our food. You eat junks and you don't care about what you consume today, not yesterday. If you are not careful of what you put in your mouth today, in fact, you are condemned dead before you are dead. Because now we are living with human beings that are very wicked, who want to make money at the expense of everybody's life. I give an example. Our eatery today, anywhere in the world, not even Nigeria, what they put together to make all those food, you are not interested to know. Now, there's what is called trans fat. You can ask anybody in the food industry, what is called trans fat. You can take it down and find out more. Trans fat is a component of oil that if it's used to prepare food, the food seems very nice and tastes very sweet. Okay? And also make you get addicted. Have you seen people that feed on the eatery, they don't go there again? You are addicted. You like to buy it regularly. Because something's in that food that gets your tongue to get attached. And that trans fat is a very dangerous fat that builds cholesterol in your vessels. So if you don't have hypertension before, if it depends on food of the eatery, you end up having hypertension. If you don't have diabetes before, if it depends on food of eatery, you end up having hypertension. That's just one. Today on our streets, our mama that do fufu, they are not aware. Are you aware that fufu now is no more a food that can eat easily? Do you care to know what is being made now to soak the gari? The gari now is soaked with what? Who knows? Anybody knows here? Oh, God. The fufu now, you can make findings. We have done the research up to Ondo State and Ekiti State, back to Lagos State. The gari is soaked. In those when we know, you must soak the gari for like 2-3 days before it gets soft and then prepare it and make fufu. Now, this woman wants to make money faster. So you want to make that gari to get softer within hours. So what do they go? They go for hypo or omo to soak the gari. And lo and behold, it becomes very soft very fast. And they prepare fufu. So you are eating a lot of fufu that contains hypo or contains detergent. So imagine the same human being we are living together in the same world, who want to make money faster at the expense of other people's life. People come to ask me, doctor, we are seeing disease that we don't hear before. I say, you will see more. Because we eat what kills us more these days, we care less. Our people that do eat, that cook meat, they put paracetamol to make the meat softer. And we said paracetamol will damage your kidneys. Now, apart from the one you take regularly, all the painkiller that will destroy the kidney, now somebody is giving you with meat again. So you can see how we kill ourselves gradually. So if you are not careful about what you eat today, then you should be ready for more trouble. So cholesterol buildup in our body is a fact that has to do with the food you take in, the kind of lifestyle you use. So I leave that for us, and I also want to talk about drinks, especially energy drinks, caffeinated drinks. Any drink that contains caffeine. What's caffeine? Caffeine is in alabukun, is in kola nut. It's in Panadol Extra. It's in Coke. It's in Pepsi. In large amounts. Okay? It's in Nescafe. It's in Lipton. Now, the more you take those kind of things, be ready for trouble in future. So if you are the type that depends on those kind of drinks, please cut it down and lower the quantity you are taking. Otherwise, it becomes a source of trouble for you in future. God help us. I want us to look at this image, this one. Now look at, please take it back. Look at the cardiovascular disease, the world's #1 killer. Look at that value. 20.5 million people are died of cardiovascular disease per year. And that tells you that is that significant number of people in this world that are dying of one disease. So now take 3% out of that. Now over 75% of people that suffers any abnormality are still also secondary to cardiovascular disease. And now look at the global causes of death that's listed there. It's like a graph. Look at the way it looks like. So you can see that it's obvious that when someone, it says, died of any disease, cardiovascular disease #1, followed by what? Cancer. Then respiratory diseases. Respiratory disease, pneumonia, tuberculosis, atelectasis, bronchitis. So many diseases of the lungs exist that you don't even know. May God not let you know them. Say amen again, please. Because people, I was telling somebody yesterday, I said, so it's like you have pneumonia. I said, pneumonia, you have a chest disease, chest infection. Chest infection comes different ways. And the rate of tuberculosis now is very high. You can ask Mr. Modele. General Hospital is suffering of number of tuberculosis we see every day. So if anybody cough for 2 weeks beside you, please run away. Tell him to go and check himself. When we were younger, we were told if you cough for 3 months, Abi, it's no more 3 months, 2 weeks. If you cough for 2 weeks and you're not getting better, don't hide yourself. Go and screen yourself for tuberculosis. So respiratory disease account for 10 to 3.7 million. Then HIV, 1 million. So that tells you that even those that have HIV now are even surviving compared to those that have cardiovascular disease, either hypertension, heart failure, heart diseases, and so many other heart problems. So anyone that has that. So this is a statistic that's a world lifted. And you can see the factors. #1, high blood pressure. Please, let's always check ourselves for our blood pressure. Is now the major prerequisite to heart attack. If you have blood pressure, please meet professionals. Enough of over-the-counter drugs. I know Aldomet now. I know I can buy Lisinopril. I can buy Amlodipine. Okay. There are newer drugs because each drug that exists, after 1 or 2 years, science have gone to the lab. What is the problem with this drug? Let's do another one that can abolish the problem. That's what. So you keep having newer drugs forever. But I tell you, to manage hypertension is not only drug. You must apply lifestyle modification to it to manage hypertension. Then again, high cholesterol. I've talked about food. Then you talk about overweight and obesity. Yes, this has been a major problem in the Western world. They are battling with a problem of obesity. We are beginning to see this now in Africa. Before, major cause of hypertension and problem of heart disease in Africa is salt and the like, while in the European world is obesity. But now obesity is now in Africa. So watch out yourself not to have obesity. Then you talk of air pollution. I've discussed that when I mentioned the issue of federal road safety. Physical inactivity. Then you talk of unhealthy diet. I've discussed that. Diabetes. Now, if somebody is having diabetes and having hypertension, it's like a death warrant. So if you have a diabetes and you have blood pressure, if your blood pressure is above 130/70, for someone that have diabetes, we are worried as doctors. But if you have only blood pressure, you don't have diabetes. If you have 130/70, we'll tell you that you are doing very well. You see the difference? A diabetic patient that has 130/70, doctor is worried. Why a man that has only blood pressure alone, 130/70, we say you are doing well? Because blood pressure and diabetes is like 2 machine guns working the same place to kill the same person. And it's work faster. I was also on air when a man was holding his chest, shouting Egbamio in the plane, and the hostess didn't understand Egbamio. So people around saying, "Kilo share," and everybody rushed at him. So when I got closer, I said, "That is any diabetes, any blood. I knew this is a bad case. He has blood pressure, he has diabetes, he was holding his chest, it was God that saved him before we landed. Because don't forget, when you're in the air, as you go deeper into the air, you go into what? There is aerocontraction. That means oxygen in the air becomes smaller. The oxygen all of us are sharing in the plane become lower. So your ability to breathe very well is affected. For those that have chest problem or blood pressure, they feel it more than those of us that don't have any problem. Yeah, but as you go up, there's a hyperbaric effect. Hyperbaric effect means that oxygen is taken away, and then more carbon dioxide is generated. So the chest having difficulty to manage the little oxygen in the plane. So those that have issues, they have problem of breathing, and they can end up having chest pain. So our plane can be tobacco. Then I talk of kidney disease, and then harmful use of alcohol. Kidney disease is now the commonest trouble in Africa, and you hear of cases that now number of people that need transplant and number of donors is like you're talking of 10 million people that need kidney, and only 20,000 people are ready to donate kidneys. So the gross disparity between demand and supply can never be met. Sometimes ago, a 74-year-old man, a Nigerian politician, very rich, who had 23 children, been on dialysis for over 7 years, and is condemned that he needs to go for transplant. He invited all his family to sit down, and they requested who is going to donate the kidney. Neither none of the wives nor 23 children was ready to donate kidney. The 74-year-old man looked at himself and said, so I'm just myself. Baba, you're just yourself. With all his money, nobody in the family was ready to donate kidney. So they have to start looking for a donor all over. It took them over 6 months before they got a donor. They have to travel to India together. On getting to India, the young lady that wanted to donate was tested perfectly okay. I have all the results with me today. The man was tested. They said he was not fit to even go through the surgery. So India kept him for another 3 months to treat him well so that he can fit for surgery. After 3 months, they said he's fit for surgery. They tested him again. They felt he's not fit to receive the kidney, and he was asked to come back to Nigeria. So eventually, the transplant was not done. He came back to Nigeria November 2021, and he died March 2022. So imagine if the donor has given out the kidney. What is it? It's a waste. So sometimes there's a level that even the kidney is damaged, that donation does not even help the person out of it. The reason why kidney problem will follow hypertension disease or heart failure, normal person like you and me that function, the kidney support the heart, 25% activities of the heart that kidney is doing. But once you have blood pressure, the percentage of the involvement of the kidney increases. And unfortunately, the kidney is not prepared for that percentage. Anything above 25%, the kidney is in trouble. So with blood pressure, kidney is receiving more than 25% of blood supply. And that's why with blood pressure, there's a high risk that kidney will come down with one trouble or the other. But major cause of kidney problem is painkillers and agbo. Painkillers and agbo. That's the highest cause of kidney failure. Okay? Followed by hypertension. So beware of painkillers, because you get to an age, you must have pain. Oh, you better go and learn what is called non-drug pain management. We can discuss that at another level, so that you will know that using drug to deal with pain should be minimal. You must know other ways of dealing with pain without being dependent on drug. So please move away from this particular slide. So you now see that we are in for so many issues. Now, risk factors for heart attacks in men, and as the case may be, you can see. We put this image for us to have pictorial pictures of what we want to discuss. Age, increased risk of heart attack. Now, over 45 years have been found out to be very common. So before it used to be over 65 years, but now we're dealing with 45. Family history of heart disease. If your father or your grandfather had one heart problem or the other, you're at risk. So beware. Uncontrolled diabetes and hypertension, I've mentioned that. Stress and mental health issues. Poor diet. Stress. When I talk of stress, people should get to know this well. Are you talking of physical stress, or social stress, or mental stress, or financial stress, or environmental stress, or family stress, or which one are you dealing with, or work stress? So because most times we face only the physical stress. Physical stress is when you do activities that wants you out. Abi? Then you can manage that way. But most times we go through a lot of social stress. You go to Yaba Psychiatry Aposi today, you meet people of high class. You meet important personnel. You wonder, well, how did you get here? Listen to their story. You weep and before you leave the place. And unfortunately, our women are more there than men. Men are the ones that smoke Igbo and all the likes. But now, women are more in psychiatry than men. So what is causing that? So it means probably the men abuse the women more. So there's a lot of social tension on people that they are unable to bear and then breaks them down. So when you are going through a lot of stress, put together physical, social, financial, environmental, everything, your heart activity will change. Because the body needs to buckle up to meet up with all those challenges. So the heart has to adjust its working system. For the heart to adjust its working system, what will happen to all the chambers? The chambers will go into trouble. The vessels, the arteries that surround the heart becomes stiff because they are now overworking themselves. Okay, so that's how it happens. So when you are going through some stress, you may not take it serious, especially if it's a job you enjoy, you are doing very well, and you're earning so much money. You will not have known that you are already going through stress. Please beware and come down to understand that what is a stress as a factor to having a heart disease. Because once the stress goes beyond normal, the heart pays for it. So you can see what we mentioned here. The risk factors still remain as it is. Smoking, alcohol, and the stress, talking of genetics, family factors, and then talking about healthy diet. So all of these play a lot of role. Then age as a factor. So next slide, please. So we want to look at the signs and symptoms of heart attack. Now, chest pain or discomfort in the chest is a major indicator to the fact that heart disease or heart attack is about to occur. Now, don't mistake it. Chest pain can be from different origin. Our chest is made up of muscle, bones, and nerves. You have muscle, you have bone, you have nerves. After those ones, you have the organs. The chest contains very sensitive organs. The lungs, the heart, and the great veins. The lungs, the heart, and the great veins. That's what is in our chest. So that's why anybody that sustained any chest injury, doctors want to be sure that these three things are not affected. Once none of them is affected, go to sleep. Once any of them is affected, either the heart or the lungs or any of the great veins, then there's a high risk that this person may not make it far. So you want to be sure the chest is well taken care of. So in that regard, the signs of pain that comes in the chest can come from any part of the chest. If it is bone origin, if it is muscle origin, if it is nerve origin, it can come from any part of the chest. But if it's a heart origin, it comes from only one place, and that's the left part of the chest. Okay, let's pick that. So second thing is that, you see, a pain that becomes chronic. Chronic means that it comes wherever and you're almost used to it, may not necessarily be from heart origin. Heart origin usually comes suddenly, and it comes sharply. It comes, and then sometimes it disappears in a short while. So when you have such pain, that gives you an insight. This pain is not normal. Just come, it's over. It's over. And then it gets more tightened. As if somebody is squeezing something. When you think about so you squeeze it, you feel like somebody is squeezing your chest. So that tells you that the pain is coming from where? From heart origin. So it's very, very key to note those small signs of a heart attack. So beyond that, you can see that the pain can radiate. Radiation of pain. You should pick your sense, where did it start from? Oh, it started from the left side of my chest. The whole of the left side of the chest, then now, I'm feeling it in my arm, like Daddy explained the other time. I start feeling the arm. At a point, you can feel at the back, or the neck, or the jaw. You see, the pain goes like this. It goes like this. Or sometimes on the shoulder. The shoulder is where the pain is, especially left shoulder. And then sometimes you can have stomach pain because the abdominal aorta, that's one of the biggest pipe that collect blood in and out. But abdominal aorta is one that brings blood to the heart. Abdominal vein is one that takes the blood away. So you remember that it's a very big artery. So you can have pain in the tummy that will be like you want to vomit. And your tummy is also excusing you. It can be from heart origin. So don't take it lightly that it may not be that. It may be more that. Check your blood pressure immediately. So again, it may not be pain. It may even be headache. So a lot of headache that people are taking anti-malaria for today now has end up taking them into what? Into heart attack. So you're having a headache that comes to you, and you take paracetamol, the headache did not go. You sleep, you wake up, the headache did not go. You take anti-malaria, the headache did not go. Are you not supposed to be surprised at what type of headache is this? So before you start thinking that it's one witchcraft that's over you, check your blood pressure first before you move out. Headache can also be a signal that you're about to have a heart attack. Okay? Then shortness of breath. You're unable to breathe very well. So by the time the chest is squeezing, the lungs that conduct oxygen is also affected. So supply of oxygen to the chest is reduced. So breathing very well becomes difficult. The chest is paining you. If you take in too much breath, the pain becomes more. So you don't want to breathe in. Okay? And that's how you need to understand when we come to rescue. When we talk of rescue, we talk of when you are alone and heart attacks about to occur. What can you do to yourself? We'll come there. Then when people are around you, what would people do? That's what we're going to end up with. Then cold sweat, nausea, and lightheadedness. I told you that man that parked his car. Nausea, I wanted to vomit. It was a heart attack. So not every vomiting or nausea means maybe it's malaria, it's typhoid, it's this and that. It's not all the time. Especially when it is not your usual thing. And it comes in a way that is unusual. There is something to tell that, why am I feeling like vomiting? What did I eat? What's wrong with me in the last 2 or 3 hours? So this gives it away. Fatigue and dizziness. You're tired. I tell people you sleep and wake up and you're still tired. Then watch out. It means you've not had a good sleep. You can't sleep and wake up and tired because something must have gone wrong in that sleep. A lot of time people sleep and they do not actually sleep. Because for you to have a good sleep, you must sleep for a stretch of 2 hours without you waking up at all. But that's when you can go through the 3 stages of sleep. Complete. Then you start another stage 1 again after 2 hours. So you oscillate between the 3 stages of sleep. Stage 1, stage 2, stage 3. You cancel it, you start again. So everybody that wakes up like 3-4 times in the night, like some of our fathers here that probably will have a prostate enlargement, are likely to wake up like 3-4-5 times asleep. Then they've not had a good sleep. Okay? So waking up, you're using drug for blood pressure, and it's one that makes you to urinate frequently. Don't take it in the evening because it's likely to make you not to sleep well. Once you are not sleeping well, be ready for trouble with the blood pressure because sleeping is one of the things that restore back our health. So when you lack sleep, every other thing will go wrong eventually. Apart from blood pressure, the next organ that suffers more of when you don't sleep well is the kidney. Kidney suffers more when you don't sleep well. So sleep is one of the things that can help you to even overcome some trouble. So beyond that, you can see those signs, as I describe it, the way those pains radiate the upper chest and moves like that. So this order of this pain can be in this pattern. Sometimes it doesn't follow this pattern. So what matters is about chest pain that radiates beyond the chest, to the back, to the jaw, to the neck, associated with headache or shoulder, then that tells you something is seriously happening in you. So we're talking of prevention. Looking at what we have said as causes, then that should give it away what we can do to prevent. Number 1, you want to maintain a healthy eating habit. That is very key. Everybody's now looking to be like expert of food. This is the best food, this is the best that. Please, there are so many chief advisors that are more satanic than you can imagine because they want to sell. Because of sales, people have very sweet mouth to sell even shit for you. So you need to be one that watch out what you're eating. regular physical activity, including exercises, okay, at least 30 minutes on a daily basis, or at worst 3 times in a week will assist you. In case you are smoking, please stop smoking. Managing stress and mental health is key. Stress. Nigerians are now very, very stressed out. We run clinic every day. On an average of 10 people, 8 to 9 will complain of sleep. On an average of 10 people, 6 to 7 have high blood pressure. On an average of 10 people, 4 to 6 have diabetes. So we're going to ask, hey, doctors, what is now happening? This is not the picture we used to see 5, 10 years ago. It means Nigerians are stressed out. So please watch out your stress level and check yourself. Regular health checkups. I want to put it here to everyone here. When we talk of medical checkup, most of us don't understand what it means. You just walk into the lab, I want to do all check of my body. The man will look at all the list of tests that exist in this world and run the test and collect your money. And then you think, I want to check up, I want to lab, I want to check up. You make it, you have done nothing. You have done nothing. You have only gone there to do tests, and they give you value for those tests. You don't even know what it means. You don't even know what the implication, because the man that runs the test is not trained to understand what it even means. He begins to interpret values for value. Doctors don't interpret value for value. We interpret based on so many parameters. In case you choose to do medical checkup, let me give you the points you need. Number 1, you must have a doctor. Number 2, you must have told your doctor your family history. The family of your first generation, your second generation, and your third generation. That's minimum. Do anybody here knows your third generation story? No. Most of us don't know it. You're talking of your great-grandfather. Okay, you don't know okay, what of grandfather? Okay, what of your own father? We don't even know our first generation stories. Disease that has occurred to your father, your uncle, and your niece and co, you must have an idea. Your sister that's in London that died of something, cancer or breast something, or maybe kidney something, are you aware? Is he your first cousin? What's the relationship to your parents? Those stories your doctor needs to know from you. That's number 1. Number 2, your own life story, your own history. You are at the age of 40, you are 50, you are 60, you have story of your life. What you have gone through in life, the kind of sickness that have happened to you, what have been treated for all in the past. He doesn't know. He's just seeing you now when you're in 50s. You tell him all those stories. That's second part. The third part, as a doctor, after hearing all those stories, he will ask you to lie down on a bed and examine you. If he didn't examine you, he's not ready to do medical checkup for you. He will examine you. Examination of doctor using our hand to touch you is not by play. It's magic trained. You will all have the hand, but when we put our hand to do something on you, it's a different ball game entirely. I put my hand on your tummy, I'll tell you your kidney is enlarged. You will never know. I'll tell you straight about this kidney is enlarged or this liver is enlarged. I'll use my hand to discover that without a scan. Because it's trained to know that. You cannot. So when the doctor puts his hand on your chest or puts his stethoscope, he's trying to identify so many information around your body. After these 3 levels, you will now sit down to compose the tests that your body, you as a person, needs to do that will reveal your state of health and can predict what could happen to you in future. It's when you do that, the doctor will now sit you down and interpret what those tests means and advise you upon. That's when you have done a thorough medical checkup. If you have not gone through this before, please try to find something to do. Get to see your doctor, tell him the stories of your father or your mother, tell him the story of your life, request for medical checkup tests you need to do. The test we do for Mr. A may not be the same thing with Mr. B. The one we do for Mrs. B may not be the same thing for Mrs. C, because peculiarity of your story differs greatly. And so that goes on to determine what is called a medical checkup. So finally, if this event of heart attack occurs to you and you are alone, what do you do? I was talking to a group of professionals, and this question was asked, and I said, and because most of them live on mainland, they work on island, they work on VI. So let's assume somebody is driving across the Tamilan Bridge and all these symptoms we have mentioned, start having chest pain, breathlessness, and he's feeling dizzy, and he's driving and he's alone inside his car. So what would the person do? Can anybody give us an idea? So what the person would do will assist, provided you understand the way to relieve the problems. So I'm going to deal with what you would do as a person if you are alone. Then I'm going to deal with if you have people around you, what you're supposed to do. Number one, the principle goes the same way. If you are alone, the first thing is that you have identified, you are beginning to have a signal of heart attack. So the knowledge you have done today is enough to give you an idea that, oh, what I came for any heart attack. So that's first thing, knowledge. Number two, you want attention. What did I say you want? You need it very critical because sometimes you cannot handle it all alone. How do you get attention inside driving on the Tombera Bridge alone inside your car? Put on your hazard lights, the double pointer, wind down your glasses, put one of your hand outside your steering and start using one hand to drive. Anybody that sees that car will know that something is wrong with this car. You have called for attention. If you keep doing that and nobody is seeing you, please drive that car in a way that road safety can actually arrest you. Yes, maybe you're on this lane before. Start to move to the middle lane. Then move to the third lane. Then come back to the second lane again. If you are conscious to do that, what are you trying to do? You're trying to get attention. Somebody, okay, are you stupid? Yes, I'm actually stupid. That's why I'm driving like that. Because you need someone to come to your rescue. Now, while you are doing all of these, you have not gotten attention. Then what you should be doing to yourself to help is that you begin to do what is called deep coughing. What did I call it, everybody? You're coughing from down your chest as if you have a heavy cough over years. You do it very heavily, cough very hard. That cough you are doing is signaling to the heart not to stop working. Yeah. You keep doing that while you are still doing your driving. You can see so many events you are doing together. You can see the reason why you need help. And you are still moving the car. You will not stop. Remember, you have wind down so that you receive oxygen. Forget about your AC. So, and people have so noticed that this car is going. Something is wrong with this car. If for any reason nobody's coming to your rescue, keep driving. You should have an idea of where is the nearest hospital that is close to where you are. If you don't know, it's unfortunate. If you know, maybe you can still press your Google to find out. Fine for you, God help. Drive yourself to that hospital, and they can assist you. But if for any reason you get help, be praying that those that will come to your rescue are those that have an idea of what we want to discuss. Because that's another dead zone. If the people that come your way don't know what to do, they will kill you faster. Okay? A lot of times we carry patients that have accidents, and our courage of those patients makes them to die. Because we don't know how to carry patients that were involved in accidents. Several times, some people were alive, but when they get to the hospital, they are dead. Because they carry them, the head is like this. The head that's like this has actually twisted the arteries, the veins, the lungs, the trachea has bent. Before you get to the hospital, he's suffocated, he's dead. And what everyone will help him, and they have killed the man himself. So sometimes knowledge is power. And we don't know it, you kill faster. So let us not assume that it happens where there are people. What can we do? Our people that are here, it will not happen in this church in God's grace. It will not happen in our house by God's grace. And to all our friends and family, may God protect all of us. So if it happens where we are, if you are one of them in this lecture in a place where somebody is having an attack, please step out to take a lead. You are all leaders. I can see you here. You are God-gifted people. You have received the grace of God. So don't be shy. You have received this lecture. You are there when I talk. God has seen you. You have an idea of what it takes to know that somebody is having a heart attack. Step forward. You don't need to be a doctor or a nurse. Okay? What we need to do is step by step. Now, the person has manifested chest pain, breathlessness, or even collapse totally. What you want to do is you want to, first of all, achieve call for attention, call for help. This language I'm using for need help, call for help, is a standard language in medical world. Though. If doctors go for exam and they are given such question and they ask, what will you do? I was answering all the answers. You didn't mention that I'll call for help. They will fail you purposely that you have failed. So I want to take note of that statement. You call for, hey. So if it's on the road or in a bush path, and you find the person lying down, When you get to the person, you still shout, hey, hello, you start to make a noise. Maybe somebody not far away, you hear your voice. Call for help is a principle of medical practice and management of health. Okay? So you call for help. You find somebody that's lying down that is not doing well. You shout. That means you want people to come around. Then you move closer to the person. Let's assume this is a human being. You can tap the person. Hello? Obviously, it's not answering you. Hello? You have to raise your voice again. Maybe you spoke too low. You get closer, put your mouth close to his ear. Hello? No answer. Are you okay? No answer. That gives you, oh, this man is really going off. Okay. You now do the next thing by touching him more. Before, you just tap a little. Now you can hit him more on the chest. There's a location on our chest. If doctors put their hands there and hit you, even if you are dying, you wake up. Yeah, there's a location on the chest. When we hit it, we use this our knuckle to press it. You wake up. Because it's pain that will transmit to the brain immediately. Okay? We'll get there because I'll show you the location if anybody's ready to expose his chest. So, when you do that, the person will feel the pain. That tells you that there's still life. But the life in him is not enough to get him up. Okay, the next thing you look at his mouth. Is there saliva in his mouth? Maybe something is really wrong that he has so much saliva, or something is blocking his mouth or in his nose. He's not breathing very well. Obviously, this man is going away. So what you have done in that is that you are not a doctor. See, I've just told you what to use to identify this person is in trouble. So after doing this, the next thing is your own safety. Whose safety? You. You now look around. So you want to set any so that rescue. So you have to look around. Am I safe? On that road. Am I safe from car or person? Okay. Is the place clean? Am I at risk of some ants that can bite him or bite me? So you are looking for safety environment and check around that everywhere is safe. So you see, make your shout again before you now proceed to start acting. So I think the person can show us that model. It's called CPR. What is called? CPR. What is the meaning of CPR? Anybody? Not the nurse? Anybody? CPR, what does it mean? Anybody? Have you heard it before? Well, what is the meaning? CPR is a short form of words. CPR. It's not CPA for those that are doing a CPA business. CPR, okay, it's called cardiopulmonary resuscitation. Everybody help me say that. Cardiopulmonary resuscitation. That means you want to send signal to the heart. Heart is the cardio. Pulmonary is the connection between the heart and the lungs. Resuscitation is to revive somebody back. Okay, so if that's the language, cardiopulmonary resuscitation, it means that what is shutting down in this person now is heart and the lungs. And those are the two major organs that sustain life. So you want to bring back life to those two organs. And I'm telling you here that what we are seeing this morning in this church looks so small and with few people. But as you are here, you can save life of somebody. Greatly that you'll be surprised that, oh, it worked like magical. Don't underrate what I'm saying here this morning. So you have done the prerequisite. So the next thing that you want to do is that you want to press the chest and you want to give this person oxygen through his mouth. You want to press the chest 30 times and you want to breathe to the person's mouth 2 times. Everything should be done so fast, within minutes. So you can see the reason why you ask for help. Because how will you finish pressing the chest and at the same time going to breathe into the person's mouth? How easy is it going to be? Now, you will not be able to breathe into the mouth, have you? And that's where doctors and nurses, they will close their eyes to do that because they want the person to survive. So if you don't have that drive, and if that drive is not burning you, you can't do it. The one I said I did in the airport in South Africa, I was wearing face mask. I used the face mask as a barrier and put it there, and then I did the blow. I don't know the man before. So if he has any mouth problem or whatever, haven't I carried one? I've carried. So it takes a lot of courage for you to come up with such mind that let me blow into the mouth. Because immediately I started, somebody that I knew came closer to me and assisted. The one that will burn you out is the pressing the chest. Very, very difficult. It's so simple, But if you are not trained, you get tired easily. Okay, so those are the areas that probably needs a lot of emphasis. That someone that is having heart attack, that's down, then get people around him, what they need to do is to divide themselves. Oh yeah, you do this, you do this. Somebody that knows give instructions. So when there's no leader to give instruction, also it causes more death. Everybody wants to assist. Eventually the person will die. But if everybody is doing what is supposed to do systematically, you'll be shocked the person eventually survives. So look at the list of things we do there that are very key as step by step to resuscitation. So see it like a business of 2-3 people working together to achieve one thing. So in order to do that, so you put the person in the right location on a flat surface, hard surface, not a foam that goes down, not something that's shaking. We always prefer the floor. If there's no couch that is standard, floor is always a better place to do that. So what do is that you have placed the person appropriately. If something is in the mouth, you clear the mouth, use a cotton wool or anything to clean off the mouth, and then you start the process. So you're putting your right hand on the left hand, or left on the right, depends on which hand the person are you. Are you right-handed or left-handed? Then when you look at the chest, that's the line, the bone in between our chest is called the sternum. Now you take a measurement by your head. The length of that bone is about 7 to 8 centimeters. So you're going to the location of 4th to 5th centimeter of that length. So that means for women, it's close to the mid part of the breast. For men, it's a little bit down. So you are putting the edge of your hand on that location. So if I put my hand down, so my left hand is placed on it to increase pressure. And I'm doing that in a way that my elbow will not move. While I press the chest, my elbow will not move. If your elbow is moving, then you're going to damage the bone. So I'm only using my movement of my body to do what? To press the chest. So if I do that, I want to count 30 pressure very fast. And immediately I'm done, somebody will open the mouth, raise the neck to open the chest, and blow into the person's mouth with a lot of energy, and blow to it twice. Stop. Then I start the chest again. We do this for babies that were born that did not cry on time. If you see us doing it, you wonder whether this baby will survive. The way we do it is horrible because we want that baby to cry faster. So we do it very, very fast. You see us pressing the baby, we use fingers to do for baby. Fast, blow them up, and within 2-3 minutes, the baby will cry, and then we know that the baby is back to life. So you can as well do that for an adult, and then you still achieve the same thing. So it's better demonstrated in real time for us to grab it better than the way I'm saying it theoretically. So if we have the opportunity, we can actually describe it further or demonstrate further as the case may be. So usually we come with mannequins for places that maybe it's a company or an industry where it is organized for that purpose. We do that as a means of trying to make it clearer because every member of the company must be able to do it. We have to be sure that everybody here can actually do it. We don't go with theory and knowledge. We have that's not the case. You step in and do the job, not be lamenting, and I was there. You see, it's always easier when you are prepared for something. If you are not prepared for something, you don't know what to do. When people die in houses, you know how people get confused. You'll be going in and coming out. You will not pick anything. You go out, you come in again. You pick something, nothing. You look, you'll be going inside your house. You have moved on 10 times doing nothing because somebody just died because you don't even know what to do. So instead of you getting to that stage, please learn the right thing and then you do the right thing as the case may be. So as a matter of fact, I want to put a stop to this talk so that I can get opportunity to get the feedback. Now, I'll further introduce this session to say he's a survivor. Now, treatment after survivor. If you have survived this situation we have described so far, immediate medical intervention is necessary after survivor. That means what he did, he went to the hospital. Yes, sometimes ago, a family want to burn down, okay, somebody is describing it, that's good. Want to burn down a co-hospital some years back. It was a lady. and the lady delivered, and she was operated. After like 6 hours, 7 hours after, she fainted, and she was resuscitated. The whole hospital was like worried, and it was the junior doctors on duty. Well, they called the senior doctor, they came back, they checked her, it was okay. But they didn't go further. They just felt, maybe she's okay now. The senior doctors left and go. In the night, she fainted again, and she eventually died. Now, the family came and said, so this hospital did not do well. This lady fainted after like 8 hours of surgery, and now she fainted second time, she died. That they have to burn down the hospital. See the hand of the person. I hope you are showing it anywhere. Okay. So, and we have to now go into what could have been responsible for the death of the lady. She actually had what is called embolus. Embolus, which is also one of the causes of heart attack. Embolus means that a clotted blood emanated from a location of the body and is moving around. And when it moves to the heart, it will hold the heart, cease blood flow, and the person will die. So in order to prevent that, what do you do? Number one, identify what are the things that can cause you to have blood clot. If you have diabetes, you're at risk of having blood clot. If you have hypertension, you're at risk of having blood clot. You travel a long distance, Lagos, London, Lagos, China, Lagos, India. It's a long distance. You are at risk of having blood clot, called DVT. You have gone on that surgery. That surgery lasts over 4 hours. You're at risk of blood clot. You had the surgery on bone, even if it lasts for 1 hour, you're at risk of blood clot. You are obese. Your cholesterol level is high. You're at risk of blood clot. You feed on some food that can increase your blood clotting. So you should know that blood clotting in the body can be a great disaster. So in that situation, what they would have done is to start the woman on blood thinner, powerful blood thinner, drugs injection. You inject, and the drug goes around the body immediately and dissolve all clotting that's moving in the body. Very important. So when somebody comes down with even stroke, the difference between doctors and our fathers outside their practice, orishirishi, is that they cannot identify the type of stroke the person is having. When you tell a doctor the event that occurred before the stroke, the doctor have an idea of the type of stroke that you are dealing with. Now, in the brain, stroke that occur is not the hand that paralyzed that is a stroke. It's the brain that had the problem. So if you like, go and sing all the beret to the hand, it will not make any difference. The problem is in the brain. We call it cerebrovascular accident. Cerebrovascular, and there's an accident that occurs inside the brain. So what it means is that a blood clot can be moving around the body and enter the brain and get to a location and block blood flow, and the person gets up with stroke. That one, we call it ischemic stroke. That means blood flow was obstructed in the brain and the person ended up with stroke. We have another type that's called hemorrhagic stroke. That one, the pressure of blood pressure in the heart is so high that the heart is trying to survive, distribute the pressure to other organs. Unfortunately, the one you distribute to the brain is too much. And the arteries and veins in the brain are too tiny to bear pressure, and it busted. And person start bleeding inside the brain. That's hemorrhagic. So these are two major types of stroke. The third one is called TIA. What do I call it? So TIA means transient ischemic attack. What that means is that the blockage that occurred was a small one, and it's just there temporarily that there's a pressure that can still move it away. So the person had a stroke in the morning, and by afternoon, evening, is out of it, it's okay. So that's what called transient ischemic attack, because the event that occurred was transient, and the body overcome it. Without taking any medication, it gets better. But even at that, you still get to the hospital, so that the doctor can identify which type were you going through. If it is the bleeding type, it's a different ballgame entirely. That one gets worsened every day. If it's the blockage type, the prognosis is very, very good. The person gets better very fast. And doctors apply different drugs for different types of stroke that occur. So even if it's an heart attack that you have gone through, that you came out of it, you realize you are okay, Then go to the hospital and report yourself, how the whole story started, what happened to you, what did you do, and then the doctors can know what to do next. So medication. Now, prevent clotting and manage blood pressure. So, like I said, blood clotting is one of the major causes of heart attack, apart from all the ones we mentioned so far. So we prevent blood clotting in hypertension by giving you vasopressin or giving you clopidogrel. If we need to go higher, we go for other things, Clexane and so many other drugs that breaks down blood clots in the body system. So sometimes somebody is using vasopressin and saying, we'll tell you that continue, except you have ulcer, I want to change it to something else. So that's also very important. Cardiac rehabilitation program. Cardiac rehabilitation program means that what are the things you need to do to keep the heart healthy? And when you get to such centers, they will first of all take you to the dietitian, talk to you about diet. 2, they bring you back to the physical exercise, physical activities doctors, that's physiotherapists, who brings you down to what you need to be doing. So when they combine these two together and they teach you about lifestyle, like these inactivities and the like, they ask you to manage your life with activities. When you do something small, sitting down for like 2 hours, get up and do something like 30 minutes, come back to sit down for another 2 hours, stand up to do another thing for 15 minutes, like that every day, so that you balance out your... Then lifestyle changes. So these include diet, exercise, and then stress management. Then follow-up care. Doctors will always give you appointments. See us next week, see us in 2 weeks, see us in 2 months, see us in 3 months. You don't even know how they determine it. You cannot even know it because your state of health and your drug you are taking determines what the doctor says. See us in 2 weeks. He wants to see what happened in 2 weeks after you're taking this medication to know whether I should change the drug or I should adjust the drug or leave the drug the same dose. So very important as case may be. So follow-up can be very, very useful. Like I started my speech by using that. In conclusion, heart attacks remain a significant risk, especially in men. Prevention through healthy lifestyle choices is essential. Early recognition of signs and symptoms can assist to save life. Resuscitation methods like CPR and drastically improve survivor outcomes. Thank you very much for listening to me.
Wow. Thank you very much, Dr. Issa, for a practical and very informative lecture. Well, there is a lot to digest from all what you have said this morning. And you agree with me that I think we've gotten free consultation from him this morning. So again, Dr. Issa, thank you very much. The MMU and the church itself are very grateful for taking your time to accord us this wonderful lecture. Without wasting our time, I would give room for anyone that have questions. If you have any questions, just please indicate. I know, yes, after consultation, there is always a follow-up question from the patient. So please, there are quite a number, so we'll just quickly take them. We have one. I will start from Bro Ola, then our mommy, and my sister Ola, and Bro Fred. I think everyone has a question. So please, let's get to it.
Yeah, the first question, you talk about the environment. Some we may not be able to control, but how do we purify our environment? For example, if your neighbor is using a generator, some of them, if you talk to them, they may not listen. So how can you help yourself to purify the environment? Number one. Question 2, you talk about agbo. I know that there are some drinks that NAFDAC approved, like ginger. What is your take on it? And can you also complement it with, if you're on medication, to use partly ginger, partly your medication? Number 3, this wristwatch, if you look at most of us now, we are wearing all these special wristwatch to, smart wristwatch to measure your BPM. How realistic is all this wristwatch that we wear? some will tell you, okay, your beats per minute is maybe 180, and how can we now transcribe that to if you are close to having a heart attack?
Thank you very much.
Okay, doctor, should we take two people or you just take it one after the
Okay,
other?
because I don't have means of writing, so that I don't forget the question.
Okay, so please go ahead.
So the first question about how do we prefer our houses. So first thing, like looking at it, we are all social animals, and then we must socialize with our environment. When something like that is happening, you need to interact with the person, you need to talk to the person, you need to show the person the effect of what he or she is doing. He may not know. There must be good communal relationship. This is very important. We must preach today. Gone are the days where you keep in your house, you don't want to know what happened in the next room. It's no more correct because you cannot live and survive alone. So 2 is that, okay, he has agreed, he has adjusted, yet it's not enough. What still gets into your house is really significant. Yeah. All you need to do is, you cannot put an extractor in your living room. Extractor is really in the kitchen. Okay? So, but today, you have some fans, you have some gadgets that also suck out dust. Some of this AC you put here, the function is far better than fan. AC suck dust of the room. That's why those guys that do services, they know how to charge you more now. They don't help you to remove the dust inside the AC, that's all. So because the AC doesn't allow those things that are flying around to get to you. But when you put fan here now, all of us will have started sneezing or coughing because the fan distributes the dust. So, but you also have some AC and some other gadgets that are called air humidifier that they actually neutralizes the air of the room. Look at Michael Jackson. He is no more. But he has a target to live 150 years. But that means he was trying God. He employed doctors, over 18 doctors, over 122 nurses, over so many number of people. And the bed he sleeps on, somebody must check before sleep on the bed. The bed is connected to oxygen, regulated to know it should not be too much while he's sleeping. The way he turns on the bed, the way he wakes up, all of these were done. But when it's good time, he has to go. So what it means that you can actually put some gadget in your house that suck away some of those things. Then stop using fan in the places where you don't need fan, and that can assist you as a personal person. Now, you're talking of NAFDAC and SON, Standard Organization of Nigeria. They are trying, but it is no to any point of commendation. I'm sorry, in case you are one of the directors here. Recently, they lock up a place in Anambra that they produce an Indomie. They certified the Indomie to be okay, but the spices is confirmed to be cancerous, that can cause cancer. That the people that package the spices themselves even use glasses and use images to do it so that it doesn't touch them. Okay, and I asked them, what of the one they produced all these years? All the children that have ate all those ones, what will happen to them later? So what we are saying is that so many pure water and bottled water that were approved by NAFDAC were actually not true. Okay, I want to do it and I know where they need it. I come and do it in this church. I will need this place. They'll give me approval. When they go, I go back to the backyard and start doing my job. Is that not what's happening? And they will not come back to know that I've gone back to the backyard. They still think I'm inside this neat place. I'm no more here. Because paying for this place is too exorbitant. So I have to go to where I'm not going to pay. So many things they have approved were not actually real. Again, our NAFDAC of Nigeria are not really doing enough in research. When you talk of FDA, Food Drug Administration in America, when you talk of a particular food, if you know the research they will have done on that food, both physical, medical, laboratory, and long years research they will have done, you'll be wondering, they spend heavily to find out what exactly is in this food that is useful to the human body, and what is in this food that can be a problem to the human body. Our NAFDAC don't have that resources. They have the personnel, but they don't have the resources to do that. So most of the time, you cannot vouch on a majority of things they approve, especially when it comes to food. They cannot. Okay, let me give you one example that will catch your mind. One Dr. Fijabi is not a medical doctor, a PhD holder, exported our Nigerian soft drink to London some years back. And what did he get from it? Do you all remember the story? Did anybody here remember the story? He exported Nigerian soft drinks to London Because he met our people in London and they requested for Nigerian soft drink because Nigerian soft drink is different from every other soft drink in the world. He packaged it in this Ikeja plant. NAFDAC were there. Immigration were there. Customs were there. All the agencies were there when it was packaged. He took it to the port in London, and at the port, the people there said, well, before you can bring it into the city, we get to take a sample of the drink. And they took the drink away to the lab. They did thorough check on the drink and said, hey, where are you bringing this on? I said, from Nigeria. Sorry, this cannot enter London. He said, I package it according to the law, law called law. This cannot enter London. The man thought he was smart enough. He sued them to the court, thinking that it's a Nigerian system. They went to the court. Within a few days, the judgment came and said, we are sorry, you cannot take this thing to London and you cannot take it away from London port. Can you see trouble? So, okay, let me take it away. I'm coming. He said, no, you can't even take it away. He thought it was a joke. They brought crane and destroyed the whole containers of all those drinks in London port. The man lost over $12.something million pounds. So tell me, how is he going to survive? He came to Nigeria to sue Nigerian Bottling Company. Since 2012 or 2013, I followed the case till last year. They've not finished the matter till now. Because in London, they identified something in Fanta and all those drinks that the concentration of what they put in there is too much for human body. And that's what you and me, when you are doing event now, you put on the table for the big man to die faster. I don't drink it, shall, thank God. So, you can see, is it not approved by NAFDAC or is it not approved by the highest standard company? Is Nigerian Bottling Company not an international company? It's an international company. Do you expect them to do anything nefarious? Yeah. Food industry is one of the worst cabal in the world you can imagine. You cannot even vouch for anybody anymore. So I'm using that to tell you that ginger, this, that is there is okay. It's okay, learn on last on you, not in real time thorough research. So if you want to do that, please be careful and then know what you are consuming. That's my summary. And the last one about wristwatch. Yes, you see, as time goes on, development and industrialization and gadgets is to improve us, to make things life easier, but we're getting it wrong more. Now, health matters is most discussed in anywhere in the world, yet people still die more on the same health issues. It means something is really not going well. Either people are not getting the messages, or people just choose to do their own. In Africa, our challenge is that you have too many teachers. Yes, we finish this talk now. Somebody will meet and go, and you believe in it. Because you trusted that man than me. Today, the World Health Organization recognizes Alagbo. Do you know the reason? They did everything possible, UNICEF and all of them, government, to kill that system. But they realize that you people trust them more than hospital. They get to recognize it, especially when it comes to maternal and child health. Your wife is pregnant now, a PhD holder, a wife that's a graduate, will still go to Alagbo to collect Agbo for pregnancy. Until when trouble busted, you now bring the woman back to the hospital. To do what? To come and die in the hands of doctors and say doctors are bad. So this is what we go through regularly that we don't understand. So those wristwatches are well configured. They have research work, development of intelligence, very nice. But keeping it in your hand is just to give you an idea. It's not total diagnostic. You still need to have your Sphig in the house to measure your blood pressure in real time. So if you have the PR, which is a pulse rate means that there's a particular artery on this our wrist. It's called radial artery. Radial artery is linked with brachial artery. Brachial artery is linked with axillary artery. Axillary artery is linked with coronary artery. So that journey is from this your wrist to your heart. So the blood that moves on that wrist is the same amount of blood that moves the number of times the heart beats. So that PR means pulse rate. That means the number of times the heart beats. So normal heartbeat for any normal person, for adult, is between 60 to 70 or 80. Once you begin to reach 90, 95, that means the heart rate is getting higher. By the time you hit 100 down, you're in trouble. Okay, you're having a pulse rate that said 105, 106, and you feel you're doing well. You're not doing well, though. It means the heart is now on panting level. It's and some of us feel palpitation. Ordinarily, all of us are sitting down here. Our heart is beating. We are not aware. You don't feel it. But when you put your hand very close and you put your attention on it, you will now know that, oh, this thing is working. But by the time you can feel it without touching it, then the heart working is overt. So our research is just a guide. It's not dependent. So you still have your doctor. You still have your swing in the house. You must have time to measure or take care of this. Check yourself. After all, you don't drive your car out in the morning without doing some basic checks. So why don't you check yourself before you leave the house? So putting that research on and put your mind on it to tell you that I've gotten something that saved me is not true. So please check out yourself at interval. Thank you.
Okay, thank you, doctor. Please, let's try to...
Let's make one question.
Yes,
one question, person.
One question, please. Thank you.
Is it Frank? Okay. I want to thank you, doctor, for this enlightenment.
Thank you very much.
I came in a bit late due to some logistics, in the sense that I'm supposed to be your case study
Okay.
by virtue of maybe what I've just survived.
Wow.
Is Mommy Pastor around? Thank you very much, ma. I think it's just about a few weeks ago now that I can confidently say that I survived pulmonary embolism that was to lead to heart attack.
Wow.
And all the symptoms that you mentioned, I think I experienced many of them. But what I have learned is that sometimes you might have been so well educated, enlightened that you have done to us today. You might have even, your own self, sort of educating yourself through learning. But when you are going through that thing that you think you know about, you may not be conscious of it, that is what is happening to you.
Yeah.
And that was what happened to me. To the glory of God, I have survived it. I have been taken off Xarelto. And I had a second tertiary opinion from different cardiologists. The last one I had, my complaint was that I'm feeling pains on my ribs. And I now learned what you said about the significance of your touching your patients in different parts.
Yes.
And he said, Ms. Olutimai, I want to be sure of the origin of this your pain, which you mentioned now. But what I'm feeling now, I think is more from the ribs. But let us do this. So he placed me on some medication, and I'm supposed to see him on Tuesday, but they called me yesterday that he traveled, I'll have to see another doctor. I'll change that appointment to when he comes back. But the medication is very effective because he suspected that the pain is coming from the ribs and not from my heart again. And I seem to believe from what I observed in myself. Okay. But my question now is this. After being taken off the blood thinner, and generally people take soluble aspirin, low-strength aspirin, wanting to prevent blood clots. Do I go back to taking the soluble aspirin? Because my main consultant, I'm seeing him also this month to confirm that at one time I was taking the soluble aspirin, then later I discontinued it. Do I resume it? Thank you very much, doctor. That is mine. And all that you mentioned, I had to go through a lifestyle change. I was given a nutritionist who now gave me a meal plan. And when I followed it properly, I saw a lot of positive changes in me. So it's very important that we try as much as we can to adhere to the instructions and all the advices that we are given.
Thank you very much. Yeah, I think this one is not a question, it's more of a consultation. and she has given it out already. There is what we call doctor-patient relationship, which she already has. That no matter what I say now, there's still somebody you still need to see before you actually get your mind settled. Yes, I have so many of such patients too that no matter where they go, if they have not heard from me or listened to me, they were not likely to do that. So it's correct in medical practice, is acceptable. Even in medical practice, you can enter hospital, you have 3 doctors in consulting room, and you say it is only consultant 3 that you want. Yes, it's acceptable. Because sometimes the approach of every doctor differs. There is psychotherapy in our consultation. You talk to a doctor, within 2 minutes, you felt, I'm well already. In fact, he gives you only paracetamol for the pain of over 10 years, and the paracetamol will take care of the pain. And they've given you all the high drug over time, and the pain is still there. It's psychotherapy. It works a lot. Okay. Now, when we come to use of low-dose aspirin, it's a standard drug anywhere in the world. And that will make me to talk about travel health. If you're going to travel, for those of us that have blood pressure or have weight or have cholesterol, please take 1 low-dose aspirin in the morning before you embark on your plane. It is very important as a principle of travel health. And then when you're coming back again in your plane, take another one. It helps a lot. It's a small drug that do magic. Okay, there are other advanced ones that are higher than it. But the one that is normal for daily life, that normal is okay, is aspirin. So if for any reason you're on it before and then you were asked to stop, the doctor that stopped it is the best doctor that can actually put you back on that same drug. So for me, because I do not have your history, I don't know the background, I can advise you that, well, if you must go back to it now, go back to it different from the way you were placed on before. Before you take it every daily, then you can take it alternate day now, just to keep the body floating. But if not, you can actually discontinue until you meet that same doctor who placed you on it, stopped it. He can now say, okay, now you can continue. We doctors, we have different way of measurement and judgment of our patients. Thank you very much.
Yes, please, can we just take your last question before we come to this?
Thank you, sir. My main question is not hard, but it's very important to me. Some people said, when you see a patient or somebody lying under something, you see people running away from the person because they say if you touch that person, maybe you try to carry the person to the hospital, they will say you are the one that... So a lot of people have died that can be resuscitated. In that kind of scenario, what do you advise? What's your advice, especially in Nigerian case? Thank you, sir.
Oh, that is even to doctors, hospital, nurses' problem now. It's not only to Nigerian citizens alone. Okay, what led to the law that says now hospitals should treat patients whether you know them or you don't know them? It was because of this problem. Okay, passerby, good Samaritan, pick somebody and bring to the hospital. They also started treating, and when they now say, oh yeah, 10,000 naira, they all disappear because it's not their family. They only saw him on the road. So the doctors and the hospital run laws of using all their skill, all their materials, free. So doctors begin to get scared of treating. 2, eventually they trace that patient is an armed robber that was shot somewhere. And doctors are now asked to come to the court to come and testify that they treated an armed robber. For years, they keep going to the court to stand in the what do you call that, their thing. So you don't want to get involved that doctors begin to get scared of treating just anybody they don't know. Similarly, it's now happened to the citizen. Nigerians will love ourselves anywhere, any day, anytime. But the country is getting bad that we begin to display some hatred. If somebody is going to be attacked on a bus or somebody is twisting his bag in his hand, you see people passing by them, nobody is going to talk. Why? Because come on, you go. Similarly, that has gone to the level of somebody is down and everybody is passing by. You see, the way to go about it is that Nigeria has not advanced to the level of DNA, fast DNA check. I was going through a security report 2 days ago, and they were tracing those that went to take the dead body, whether they were involved in the death of the body in a developed country. So they now do fingerprint of all the hands that touched the body so as to identify which of the hands that killed the man. You can imagine that's an advanced world. So those that even carry the person that touched, they want to confirm whether they were involved in killing the person. But that's not here in Nigeria. They just look at it, oh, now you carry and come, and now you kill him. So trouble bursts. So what it means is that sometimes we are now getting more security conscious. So you see such a body, take the picture first. 2, make a shout. 3, wear a glove, and then start what you can do. Pray to God. In your mind, you are a good person trying to do what is good, and God will reward you. It doesn't turn to become a trouble for you. That's what I can say. Thank you very much.
Okay. So, sorry, I'm going to ask more than one question because I patiently waited to listen to him.
I think and I approve that because when our father gave introduction that people should go around and greet themselves, nobody greeted me except her.
Thank you, doctor. Thank you. So my one question is, how do you know if you have blood clots? Is it that if it's in your body, you know within a certain days or because you said it moves around? So that's my number one question. Number 2, is kola nut and bitter not healthy? OB and Orogo, are they healthy? We talked about bitter cola. Okay, bitter cola. You talked about caffeine and being careful about it. So what about coffee? What does that do to the health? And then the last one is, you talked about agbo. What exactly is bad about agbo? Because when we were younger, we did take agbo. So just to appreciate the concern that you have around agbo. So those are my 4 questions. Thank you, Doctor.
Thank you very much. The questions are even very straightforward and very important questions. Number 1, how do you know that you have a blood clot in the body? Please, let's listen to this part. It's very important. Blood clots can be very small, tiny, and can be bigger. Depends on the type that form in the body. I've given you an idea of predisposing factor to blood clot. Sitting down for too long, for those that have the risk, you're already at risk of having blood clot. Being in the air for long hours, you're at risk of blood clot. Okay? Now, it can be small. I saw a woman on Thursday. She's having a knee pain. She just woke up in the morning and started having knee pain. She didn't fall. She's still young. She's 42. Okay, what could have led to this? She has checked, she has done x-ray, she has used all the painkiller. The pain is not going. So I asked her to lie down, re-examine the leg. When I wanted to examine, they said, they've checked. I said, no, don't worry, let me check the leg again. So checking the leg, she doesn't know what I was looking for. I was already suspecting a DVT. Because the back of the knee and the calf muscle is the most prone area to blood clot. So when I placed my hand on the knee at the back, I felt something is here. And how do I know? When I use the back of my hand to touch different part of your body, I can measure your temperature. So I realized that location has temperature higher than the other leg. First signal. Okay, I realized me using a small hand to touch a little, the pain is much. The other one I'll press before she'll feel the pain. So it means something is on the surface that's actually running somewhere. Okay, I send her for a test. Lo and behold, the blood is back. There's a blood clot in that location. Okay, that's a signal. That's, okay, is it paining you? Is it warm or is it cold than the other leg? God gave us 2 parts of our body to actually determine which one is wrong, which one is having trouble. Yeah, that's why you tell me now you have pain on the left breast. I'm going to check your right breast before I check your left breast. But I want to use the right breast to understand what type of breast you have. So that when I'm going to see the abnormal one, I will know that this one is abnormal. So God gave us 2 parts of our body to know that something is going wrong somewhere. So I told her that you have a blood clot in the leg. So sometimes that's a way you can actually identify that. As simple as that could be, not much to do. Now, the second thing you mentioned is about, you talk of bitter cola and cola nut and the like. Now, as a medical doctor, I also have developed so much into natural science. I'm involved in so many organizations, both local and international, in terms of researches into health system that have to do with natural party. We call it naturopathy. And that has given us a lot of insight to so many things that we don't take note of before. Now, cola nuts contains caffeine. Our fathers in those days eat cola nuts like eating sweet and bread like normal. But you see them, they grow older, then they lost their sleep faster because they have forgotten that in the kola nut, there's high amount of caffeine. Some countries, they will not allow you to bring kola nut into their country because of the caffeine content. So kola nut contains caffeine, but bitter cola does not contain caffeine. Bitter cola is good for other things. It contains tannins and saponins. Tannins and saponins are found to be very useful in bringing down blood pressure, are very useful in eliciting your immune system, okay? But when it comes to the material, that is the flesh of the bitter cola, when it becomes too much, it can become deposited in the body as well. So eating it should be also done minimally, okay? And not to now make it like too much exactly. So but it's good because of the tannins and saponins content in it. So that's what I can tell about bitter cola. Then you talk of coffee. Yes, coffee also contains a lot of caffeine. So in fact, that's why they call it coffee, because of the caffeine content, okay? Caffeine is found in Alabukun. You go and read Alabukun. Go and buy Alabukun from Mola now. Go and read it. You see cocaine is there. Yes. Cocaine is in Alabukun. Caffeine is there. So when you drink Alabukun, you see your body in fact, you are an Igbo smoker already. So anybody that tells you that I'm more like Alabukun is a drug addict. Again, Panadol Extra contains high amount of caffeine. Again, Pepsi and Coke contains high amount of caffeine. Lipton contains high amount of caffeine. So, Lipton can turn you to a mad person. I have seen a patient, a 55-year-old man who has lost his sleep and is jittery. And they've gone everywhere to look for the spiritual cure for that. After looking at all the physical cure and the spiritual cure, all of them fail. This time I'm telling you, just about 2 weeks ago, I just told him, I said, do you take Lipton? He said, yes. I said, that's the source of your trouble. And the man stopped Lipton the last 2 weeks, and the shaking has disappeared. So I asked them that all the money I spent on the physical and the spiritual, can you bring it to me now? And they ran away. So you see, knowledge is power. When you have a background to what you do, you act on it like miracle. So I said, your Lipton is too much. He said, you can't do that way. Morning, afternoon, night, Lipton. So eventually he stopped the Lipton and is now getting back to normal. So you can see what you eat, what you drink can be the source of your trouble. God help us. So my concern about Agbo, like every other doctor will say, anywhere you go in Nigeria, doctors will always say, no Agbo, no Agbo. As if we were not giving Agbo when we were younger too. We're giving Agbo. So what's our concern? Our concern is about you and our children. Don't forget that the paracetamol we're going to give you was originally the chloroquine, the anti-malaria, and the blood tonic were originally known, identified from trees, herbs, roots, and leaves. That was the first place they identified it before they turned it to tablets. But if you know what they go through to bring it as tablets, you will marvel that, Now, let me give you an example that will show you how much research has worked. Anti-malaria. We'll tell you when you take it at 6 o'clock this morning. The next dose should be when? Okay, thank God. I've had it. I must get it. Somebody say 12 hours. Somebody say 8 hours. You see, the first time you take anti-malaria 6 o'clock this morning, your next one should be 8 hours after. Please take note of that. I want to show research here confirming if you extend the second dose beyond 8 hours, you've given space to the malaria cells to run around again. You will notice if you can do the research yourself, to manage malaria, you can do this research, I'm telling you. When it's 8 hours, don't take it. You realize that the symptoms you're trying that disappear in the morning, it's as if it's coming up again. Just take it again, it will go down. So that tells you that every drug has what is called T-half. T/1/2. We call it drug half-life. Every drug you take has the duration it's going to work and maximum work. Get me right. So the blood pressure drug too has been designed. I take it 3 times a day or 4 times or once daily. It's because they have studied the half-life of the drug, how long it's going to work maximally in your body. The work done to arrive at that is not a joke. Oh. Who will do that on Agbo? Nobody. 2, they combine together, 1 tablet of paracetamol contains 500 milligrams of paracetamol content. How did they get to that? So they have now advised that, okay, you need 1 gram of paracetamol to abate the fever in your body. So who will tell us how many cups of Agbo we drink to actually do the job? Nobody. Odimejio. Eleketa, it has to do with hygiene. Now, if you see the process of producing 1 paracetamol, if you see how it goes through the industry, it will run from here to outside of this place. The machine keep running before the paracetamol will come out on the other side. But Agbo na biti mojo kosi no mati say, biti mo jawe no mati say, be a motion, be a motion. So hygiene level becomes a problem. So how do I know that I'm not drinking something else with the content of the Eweti Mofemo? This is our concern. Now, again, how long should I boil the Ewe or the herb before I drink? That's where the trouble comes in. Now the leaf has the content that will treat the disease. Confirmed. Okay, it has it. But now, when I boil it for 30 minutes, other things that I don't need as join the content. Those other things that I join it, I drink it, they are poisonous to my kidney. They are poisonous to my body system. So it means nobody is determining the concentration of the Agbo. So that is why painkiller and Agbo are the leading cause of kidney failure in Nigeria as we speak today. So be careful.
So I think we have, after Prof. Fred, we have 2 more people to go, both San and... okay, go ahead.
Sorry, mine is not a question.
Okay, sir.
I just need a reaction from you. And it's based on my personal experience in life. When we were very, very young, where I stayed with my grandmother, when we are to, because you talked about our intake, what we take as, when we were young, maybe 4 of us will be eating 1 meat. They will cut 1 meat for 4 of us. You hold whatever. You just put it on your left hand and you'll be eating the food. But the head of the house, like 4 meat. You that one, and you never had the man dying. Maybe he will spend 100 and something years, 100 and something years. But we are telling, we've come to ask a question that, in fact, when I grew up, I told my wife, I said, I should be doing the same thing, that this is what my experience. He said, no, like, you don't need red meat. Which red meat? When I was deprived when I was young, and now you want to deprive me of red meat. So, I'm only, it's an experience. I'm just sharing what I've went through and what you... And that's good. That's one aspect.
No problem, sir.
Then you travel. The same my wife and I, we met a doctor. Every time we go to visit that doctor, you see a bottle of Coke
In front of him.
in front of her. Yeah, okay. Woman, she will. I just look at this one. I say, Madam, this is right there before he would still call Coke and. The woman lived for Mrs. I don't mention her name. And so I come. They tell you again that too much Coke is not good for an adult. This is not good for. But I've been to an environment whereby anything they eat, you just see the jar like this, and it's filled with sugar and all this. And another thing I'll quickly say because of that jar I'm talking about, we talk about ice. That you drink cold water, you drink room temperature. Are you confusing us? At one age, you don't drink. But you got to that environment and you see, in fact, whatever water they put, they will still put ice. And they will still be drinking. But when a doctor will tell you, no, by the time this thing gets into your lungs, it has the temperature there. They will give you excuse. You will read this one will tell you this, just confuse you and whatever. So those are the things that. Then the last one is this egg. They will tell you, don't eat the yolk, don't eat the whatever is for. But now, in fact, like I met 2 doctors that said, look, 2 eggs is good for you a day. So what are you say for too much of protein? So that's why, as I said, my own is not a question. No, I just need your reaction to it. Whatever.
Please let me say a round of applause to our daddy. Yes, this part of the talk is not a question, it's Oragba. And I want us to go along with it together. Yes, I like some of the words he has used. You see, I'm in the public sector and I'm outside the world. I interact with people more than you can imagine. So things like this is not actually a surprise to me. Now, the part, he says something that I also want to teach us. You read through and you get more confused. Yes, you'll be more confused. A lot of us depends on Google now before we meet doctors. If you do that with some doctors, you can get away with young doctors. But if you meet some of us in the mid and upper, you fail because we are trained differently from Google. Google was not existing when we were trained. So when we finish all the pages I've read in Google, we'll dismantle it for you within one word. Because our training is rich. Nigerian doctors are one of the best in the world till tomorrow and next tomorrow. Because it's not by mouth. The training was too terrible. And we're given by good teachers. God bless them, and they pass it to us. So beware of your Google answers to questions. You either get more confused, or you get more disenchanted, or become non-responsible to things. Now, I'll come back to the issue of meat. I like the illustration. When we talk nowadays that you should eat right. Everybody say that, what is eat right? And I go to places, like example you gave, when we were small, our father take big meat, we take all the small meat, and then said, the one is even good. In some environment, the children don't even eat meat. So you cannot even eat meat. So what are you saying? So imagine, and today at Jali, no, thank God we are alive. So what is there, sir, is that what is the difference between red meat and white meat? And what is our body component? Let me give a general statement. Our body differs, sir. Our genetics differ greatly. And God has designed us differently with different question paper and exam answers. This is our tomb. If we are twins, it's not the same. For everyone that exists on this earth, we are about how many billions now? No 2 people have the same tomb on earth. Meaning that, sir, what Mrs. A get done and get well with it, Mr. B may not survive it too. So our roster, our timetable, our exam question differs. If I went jams had all this, like somebody sitting beside you, is not answering the same question. I said, these people are copying God. Because God has done our life in a way that we go through different things. And don't copy the next person the way he's doing his own. You might fail. Now, as we grow, what do our body needs? Our body needs the full component of balanced diet. The carbohydrates, protein, fat and oil, minerals, vitamins, and water. Just want somebody to just pronounce it, water. So those 6 things are basic components of balanced diet. And it must be in adequate quantity at certain ages as we grow. Once it's not balanced, you grow up having the deficiency of one of them. But as we grow to a certain age, our body begins to disintegrate backward. And what is the age? Who knows? The age when the body begins to disintegrate backward. What's the age? 50? Any other age? Yeah? 45. Okay. Any other one? Third one? 70. Okay. Okay. Let me help you. Our age by 40. Yes. By 40, it stops growing. Everything's stagnated. And after that 40, it will turn back. So for you to know, I'll give you an example that will make you to know that it's 40. For those of us that are not using glasses now, and you're less than 40, you will not understand. But if you are 42, sitting down here and you're not using glasses, you can tell me you don't read Bible the same way like before. Before, you read Bible anyhow, but now, either you do like this, or you do like this, one of the two. So that tells you that your eyes is what? It's telling you that you are 40 years of age. So when we ask you in the hospital, we that are not ophthalmologists, okay, Daddy, okay, how old are you? I'm 43. You are 43. Because your eyes is telling you that, Oga, you are now 40. So 40 years is a determinant age of coming from somewhere and crossing to the next part. So let's take note of that. So once you get to that stage, you now need to learn how to eat, what to eat, and when to eat eventually. How many things did I say? How to eat, what to eat, and when to eat. Those three questions, anytime you want to eat any food, ask yourself and answer it. Because we are fond of eating junks and eating rubbish. And we eat at the wrong time. Majority of us, careless. Okay, let me emphasize the aspect of red meat and white meat. What are the white meat? Who knows? Chicken, turkey, bush meat. Okay, yeah, I think I like somebody that said that. Now, white meat are birds generally, all the birds. Even all of the birds, they are very good. And particularly, that Yawut is very, very good. Yes, guinea fowl. In case you don't have an interest in it, please go for it. It's more better than other birds. And when you eat it, I advise you eat the bone with it. The guinea fowl, very rich in omega-3 fatty acid. Omega-3 fatty acid is what the body needs more to maintain your normal cholesterol. So guinea fowl is very good in terms of birds that contains content that does not affect the body. So but birds generally are good, but you want to avoid turkey to some extent, and you want to avoid all the frozen ones, please. Don't forget that the same chemical we use to embalm the dead body in mortuary is what they use to preserve the frozen chicken and frozen turkey. I hope you are aware of that. Okay, so no matter how much you cook it, even our fish now, I'm aware they use this chemical also to preserve it. So, like I gave us in a lecture, we are living in the world of Daju. I want to have money at the expense of other people's life. So, growing up, you need more meat. So, our fathers got it wrong that time. We, the children, are the ones to eat more meat, while the old man eat less meat, especially red meat at that time. But to show you that so whereas it's supposed to be the reverse. It should be the children that eat more of the meat, while the old man just eat minimal red meat. But at 40, forget about red meat completely. The red meat will promote your cholesterol. You get the bad cholesterol. Cholesterol are 5 members of cholesterol. They are family of groups of cholesterol. You have the total cholesterol. You have the triglycerides. You have the high level density cholesterol. You have the low density cholesterol. You have very low density cholesterol. Those are 6 groups of them. Now, out of these 6, 2 of them are most dangerous. Once they are high, definitely be ready for trouble. Number 1 is total cholesterol and the low density cholesterol. Those 2 are the worst of cholesterol. Whereas those are the ones you find more in the red meat. Our father is not here to understand this part. Okay, the wife is here. So the red meat contains more of the total cholesterol and the low density lipoprotein cholesterol. So when you eat on it as an elderly person, if you have not developed blood pressure at that age, then eating more of that will predispose you to develop blood pressure. That's just the basic teaching. So that's about that. So at this age now, you should better shift to more of fish and then white meat, as the case may be. That assists. It's still the source of protein you are looking for. Don't get stuck with red meat all the time. That will help you. Now, the Oragba is plenty. Nobody can talk now. I'm still talking. So now he mentioned the aspect of what's the second one? Coke. No. Egg is the last one. Coke and cold. Yes. Okay. Mommy, don't expose our daddy here now. So Coke let me explain to our daddy. You see, our body differs. In Africa, people in Niger, I studied first in Maiduguri. So I had interaction with people from other countries more. People from Niger, they have a genetics that if they eat the whole sugar of the world, they cannot have diabetes and have any problem. That is their makeup. So if you go to their country and you see them drinking sugar and you join them, you go fall into trouble. You will not know that your own genetics has something resistant to sugar effect. Don't join them. Oh. I'm telling you, the whole of people from Niger, Lokembe, sugar will affect more. So as a student, I have a lot of them as my friend. They speak French. So we go back to the room. They want to drink tea, want concentrate tea like this. Do you know how they make the tea? The tea is leaf, green leaf like this. They will now put sugar on the leaf and boil it. It's the sugar that will turn to water. And then form the drink and we drink it. It will shock you. And we'll go back to the class. So that's what they drink every now and then they're used to it. So if you think it doesn't have effect, it may not have effect on them, but for you. So even in Nigeria too, we have some family that have high resistance to such things. It will not affect them. So don't say because somebody is taking it, you also want to take it. No, our body differs greatly. And let me clear his mind about the doctor that drinks the Coke. See, I have been in practice for almost 20 years as doctor. And the set of people that drink soft drink most are doctors. And let me explain the reason to you. While I was in Bagada General Hospital as a doctor working in obstetrics and gynecology is one of the craziest work you can do. Sometimes you have 5, 6 surgery pile up back to back for you. And you are the senior doctor to operate on all of them. You start around 5 p.m. By the time you are done with everything, is around 12, 12:30. You are tired. There's no food in the hospital again. Nobody's hawking anything anymore. The only thing available is one woman say, hey, Coke, I take Coke and drink. So that's what led to doctors, they get addicted to those things because they have worked their life to the point when there's no food and what's available to them that time again is Coke and Fanta. As I speak with you, doctors may end up going on strike because of LUTH. Why? There's something we call call duty. Call duty means that everybody closed by 4, 5, you go home. 2, 3 doctors remain to do the work of all of you throughout the night.